Hi, greetings to you. Hopefully, you're doing well. I want to welcome you to HBMS TV Talking Health. And for today, we are going to be discussing about hypertension. And the question is, does hypertension run in families, or it is the people that in the family that are not running? This is all brought to you by the Visionaries International, powered by HBMS TV, to make sure that you can continuously learn about your health. And this program is proudly sponsored by several institutions, especially health training institutions. For example, Mitiana Institute of Nursing makes sure that we have these programs running. And if you're out there and you need to be admitted in such institutions, beautiful institutions, you can contact us on the number you see down there, and we will be in position to guide you. So basically, you who is out there, who is following us at HBMS TV, what's hypertension? Hypertension simply means high blood pressure. And when you look at the types, we have what we call the essential that comes by its own. Then we have what we call the secondary hypertension that comes as a result of anything. And we all have what we call hypertensive agents and emergencies. You will know this in details as long as you keep following us at HBMS TV, sponsored by Masaka Home-Based Medical Services International. So basically, when you look at blood pressure, there are ranges. For example, when you look at 120 out of 80 millimeters of mercury, it simply means your blood pressure is normal. Then when you go on, you have what we call normal, but it requires control measures. Then 140 to 90, that is already high. You need to do something about it. Then talk about the pulse, the rate at which the heart beats and all that. You must be in position to control that. And more importantly, you also need to know your temperature ranges using a clinical thermometer. You need to know what is below and what is above. Then you talk about respiration, how somebody breathes in and out. Then you also need to know the importance of water in our bodies, as it plays a very important role in managing high blood pressure or managing your blood pressure. For example, a glass of water after waking up is very good. Then 30 minutes before meal. Then you can talk about 30 minutes before taking a bath. You can even talk about 30 minutes before going to bed. All these times are very, very vital for you to take water, because water is life. And such information is very good information that you need to share out with people to make sure that you can help them live a healthier life. Very many people out there know that water is very vital, but don't know the time they're supposed to take it. More importantly, in relation to what we call high blood pressure, I wanted you to look at the health pyramid. How are you supposed to live your healthy life? Do exercises like jogging for 30 minutes, eat whole grain foods, cereals and all that. Then do fruits and vegetables. Do proteins, example is salmon, fish, tuna fish. All those things are very vital. More importantly, you need to reduce sugar and fats in your body. But surprisingly, this health pyramid, we make it upside down. And at the end of the day, you're going to find that if you have a normal blood vessel, it becomes occluded, or it has deposits of fats in it, and it is going to narrow. But remember, your heart is now pumping blood through a narrow blood vessel. And what is going to happen? That is where the high blood pressure is going to come from. And when you go to the hospital, you're going to start taking drugs here and there. But you all know that some drugs have side effects on our bodies. That is why on several occasions you see people taking drugs, but they tell you so and so this happened because of the drugs. And how do you know that you have high blood pressure? Surprisingly, it is by chance. However, there are some signs and symptoms. However, I do not say when you have these, you automatically have high blood pressure. For example, severe headaches, talk about fatigue, talk about vision blurred, or vision problems, chest pain, difficulty in breathing, then irregular heartbeats, blood in urine, there it is very severe, pounding in the chest, persistent palpitations. All these things make you be at risk of developing hypertension. But surprisingly, I want to bring it to your notes, you is following us at HBMS TV, that hypertension requires a medical diagnosis. Don't go out there and make your own diagnosis and name yourself a condition. High blood pressure often has no symptoms over time. But if untreated, it can cause health conditions such as heart diseases, such as stroke. Very many complications come along with untreated hypertension. And now, when we talk about what are the risk factors of hypertension, what are the things that you look at and you at risk of developing hypertension? Smoking, either active or passive, overweight or obesity, lack of physical activity, too much salt consumption, too much alcohol consumption, more than 1 to 2 drinks a day. I don't say don't drink, but more is very bad. Then stress, then older age, talk about genetics, talk about family history, chronic kidney disease, and very many other adrenal and the thyroid disorders. And what are the complications of hypertension? They tend to affect your brain, they affect your heart, they affect your kidneys. And more so, even the blood vessels can be affected in one way or the other. Those are complications. So the moment you do not take care of your blood pressure and it is uncontrolled, at the end of the day, be assured that your vital organs in the body are going to be affected in one way or the other. And more importantly, how do you prevent? What you need to do is reduce salt intake, less than 5 grams a daily. Eat fruits and vegetables regularly. That relates to the health pyramid. Then avoid saturated fats and trans fats. Avoid tobacco. Reduce alcohol intake. Be physically active daily. Make sure at least you work out. Even if you go to the shower room, do some push-ups, do some push-ups. You can have a skipping rope for you to help you live a healthier life. And how to detect hypertension? Health workers should regularly check people's blood pressure. No symptoms does not mean that you do not have hypertension. People might have high blood pressure without any warning sign or symptoms. That is why medical checkups, as HBMS TV, will recommend people to always go for checkups. What we are targeting is doing massive health education to make sure that people can know how to live a healthier life and be healthy, and at the end of the day, we can have a healthy state. And more importantly, I want to tell you that among the things that you need to do to prevent, those are some of them that I've shared with you, but I want also to bring it to your notice that hospitals give antihypertensive drugs and other medicines that I would recommend you is out there. Before using them, seek for medical advice. I don't want you to go out there, one diagnosis one time, and they tell you you're going to start antihypertensives. No, make sure they run several investigations to confirm, and that is done by qualified personnel. Now, the most important thing is nutrition and hypertension. I want to bring it to your notice that due to the fact that hypertension is becoming a problem, actually with its sister problem, that is diabetes, very many people are affected, but it also relates to the nutrition, it relates to the diet, and very many people are seeking for therapies, alternative therapies. They are seeking for herbs. But I want to tell you that among those things, for example, the omega-3, talk about to the coenzyme Q10, talk about the oil fish, talk about the botanicals, talk about the blocki, talk about yams, talk about yeast, talk about potatoes. All these things that our grandparents used to eat are very vital. Talk about vitamins, talk about the cereals, talk about rice, talk about rice bran. All these things are very vital in fighting hypertension or even reversing it. But the good news is, for you to be in position to prevent hypertension, we have very nice proven products that are even approved by the National Drug Authority here in Uganda. They are approved on the world market to make sure that they can help you live a healthier life. For prevention, we have Coledus, we have C24/7 or complete, we have the Living Alkaline Coffee. Then for reversal, alongside the treatment one is on, I don't want you to encourage people to stop the treatment. No, this is just an additive. And for that case, we have again Coledus. You can use C24/7, you can use Living Alkaline Coffee. If somebody is obese, you go for the Living Burn Coffee. But more importantly, after somebody is stabilized, you need to put them on Vidamax to make sure that they live a healthier life. And I will tell you that you need to seek medical attention from hospital whether to withdraw from antihypertensives if you've been taking them. Somebody will share with you this link, will guide you more about these products, how to take them and how to use them. HBMS TV, Talking Health.